Shubor nakaslem jong unongsan Hima.
Katanat Health and Family Welfare Department hakajing trelang bat ka Zule Foundation mentakasni kala Pynlong ya ke program Pynlong Halor Kapang Disease Organ Donation and the Way Forward MIIT Brokdin Dhankati Shillong hakaba u Dr. Joram Beda Commissioner and Secretary Health and Family Welfare Department ulalong kumukongsan hakajing donlang u Dr. Sarbeshwar Saharia Patmashri Chief Transplant Urologist KIMS Hyderabad and Pro Vice Chancellor USTM Meghalaya nang taka Priyanka Bora CEO Zule Foundation bat kiwei habakran kan si u Dr. Joram Beda ulapan pau ka jingkerman baka Pynlong ya kan program kan ajing tip nakabenta ka tenat badai pet halor ka jingarap nakabenta ka jingbu pli ki Dkhot met syakitu ki nongpang ki badan kam kerki lingbagan ka jing sedang ban Sngewbha ki kerman baki pat ba ken Sngewbha ya ka jinon kam banno senyang ki Dkhot met jong u ne ka briu ka balaklat no na kan ka perthei nakaliang u Dr. Sarbeshwar Saharia habakran syapang ka jingduna ka Jingai Sngewbha ya ki Dkhot met ki banbu kaliang haki briu hapo India ula ong kalong ka badan kam ki pat ba ban Sngewbha ya ki jinon kam banno senyang ya ki Dkhot met jongki badru ban Sngewbha bha hadu katno kani kan yarap ya ki tu ki briu ki badan kam
increasing every day. About 10 lakh people develop organ failure every year, in the country. And that includes the failure of the kidneys, the failure of the heart, failure of the liver, failure of the lungs, particularly became more important due to the recent COVID pandemic. And all these people, I think more than 80% will die within a very short period of time because there is no definite treatment we can offer them. And treatment is very complicated and very costly, and it is not available in all parts of the country. And particularly like areas within the northeast, the facility for transplant are very limited. And these are the reasons why the patient or the people cannot get the benefit. But some people with kidney failure, I should not say they are fortunate, but at least they have the advantage of sustaining life for a considerable period of time with the help of dialysis. Dialysis is a very simple medical procedure. The blood is taken to a machine where the blood is filtered, again given back to the patient. It has to be done at least 2 times a week. Every session lasts for about 3 to 4 hours. So for its lifelong, there's no time limit for it. As long as he lives, he has to survive only on dialysis. So this is not a very easy procedure. The patient doesn't survive for a very long time. Of course, this again depends on the quality of dialysis. At our hospital, because the private hospital in those places, the quality is very good. We have got patient who is more than 10 years, they're still sustaining on dialysis. But unfortunately, the people who develop liver failure, heart failure, they don't get these options. There's nothing like an artificial life support. Once they develop the disease will kill them. Until the time the disease doesn't kill him, he'll survive maybe a few months, maybe a few years. But ultimately, he has to live without any treatment. So organ transplantation has always been in the dream of the medical profession since very, very long time. Always Chinese, I think, they started first in about 650 BC. They tried from different sources, but they didn't succeed. The first successful a kidney transplant was done way back in 1954 in the United States, where the kidney from identical twin brothers were transplanted. And that is the first milestone. And he was awarded the Nobel Prize for doing this breakthrough treatment in the field of transplantation. As I said already, that let us not talk about the technicalities of transplant. That is not necessary for you to understand. What we are going to concentrate mostly on the problem of donor, because you see here that there are 4 types of donor, and the number 1 is the exactly what Dr. Joram has already talked, the brain-dead donor, that is called, and they are the ideal donor for any organ donation. A person who is brain dead, I will come to it a little later on, and then they can donate all the tissue and all the organs in the body, except the brain. They can donate heart, they can donate lung, they can donate liver, they can donate kidney, they can donate intestine, everything. Second is the donor after cardiac death. That means it is not that a person who is dead in the hospital who can take the organ, no. Suppose a person who is under treatment at a hospital and he is undergoing treatment under medical supervision and suddenly he develops cardiac issues, cardiac arrest, and could not be revived. And those patients can be considered because the time is very important in organ transplantation. That within that particular time we have to remove that organ. It is only possible when the person is dead or he expired in a hospital. The third, that cardiac death, suppose somebody dies in the house and they call you, sir, I am ready for the organ donation, that really doesn't help. Only thing they can donate is the eyes, the cornea is what you call it. Because cornea doesn't survive on blood supply, they survive on lymphatics. So only cornea can be removed from those persons. Other organs have become useless because there is no blood supply. And the organ doesn't live for a very long time, maybe for 15, 20, 30 minutes. Within that time, all the organs will be irreversibly damaged, so they are not fit for transplantation. Of course, third, fourth one, I talked already, the living donor. And there's a lot of issue, the legal issue involved in living donation. And I will come to that a little later about what is the Human Organ Transplant Act. Now it becomes, and we are on the other side, the surgical side, we are the urologists. So I am basically involved mostly in the transplant, so I call it a transplant urologist, anything to do with the transplant. So I have been working at Kim's Hospital in Hyderabad, which is about 1,000-bedded private hospital. We have got a very, very active team of transplant. And we do multiple organ transplant, not only kidney, there's a kidney transplant, liver transplant, bone marrow transplant, corneal transplant, lung transplant, liver transplant, heart and lung transplant. Anything you call, it is there. We have a separate floor dedicated only for the transplant. Of course, that is a different issue. But what we are going to talk today is about, little bit about organ transplant. As Dr. Joram has said, that there is a multifaceted specialty. Firstly, the medical part, we know that this is a disease can be cured with the help of transplant. That is totally being at our hand. But the other two facets are, one is the legal thing, that's what he has again just mentioned, the legal issue related to organ transplant. And thirdly, again, what we are going to talk today, the social side, where unless the society is involved, we cannot go forward. It's not possible for us to do anything. So that is where we are today, to explain where exactly we need the help of the society. Zule Foundation has been working in Guwahati, and they are going to different places, different states within the Northeast. And just like today's meeting, they are trying their best to spread the message of organ donation. Now I will be just give you a little idea of what exactly, because many of you do not know, as Joram has said, that about what is transplant and how it is done. I am not going to go into the technicalities of transplant, it is not necessary also. But mostly I will be talking about what we are here today is the organ donation after death. Our program is not the donation by a living person that anybody can donate, suppose he wants to do. Within the legal problems are there, but there is no restriction in a living person donating an organ. But our issue is not that one. Our issue is the organs, how it can be done, how it can be donated from a person who is already dead. Because you all know, everybody has to go from this earth one day. We have to die. Whether we can do something good to the society before we die or after we die. And the only way, at least from our side, what we can do is that we can help some suffering people to live a near normal life, I will say. Suppose we agree or we understand the process of organ donation. There are a lot of religious things are involved in organ donation. That is mostly evident in Sri Lanka. Sri Lanka has the highest number of eye donation in the whole world. That nobody knows why. They are related to the local religion, what they mostly follow. I think that has got a lot of effect on the organ donation. Other organ donations are not there, but mostly eye donation, if you go to Sri Lanka, they are leading the whole world. And they are exactly the opposite in Japan. Though it is an adverse country, socially, economically, otherwise, and medically also, but organ donation is strictly prohibited there. I think the religion they follow doesn't allow organ donation. So there are very few organ donation in Japan because the religion doesn't permit them to donate that organ. So we have got so many issues to be discussed, to be talked to the people and make them understand what exactly we stand today.
So Meghalaya is known for its scenic beauty and rich cultural heritage. We all know that, but lacks a robust organ donation system. Despite the need, the state faces challenges in organ donation and transplantation. So the current state of organ donation in Meghalaya, Sir Zoram Mehta has already mentioned that there is limited or organized data in the state. We do not have the number of people that actually gets transplants done from the state in different states of India. So there is a scarcity of data regarding organ donation and transplantation, so indicating a need for comprehensive data collection and analysis. Hospital infrastructure, not many hospitals in Meghalaya currently possesses the necessary facilities and expertise for organ retrieval and transplantation. There is an urgent need to establish adequate infrastructure to support these critical medical procedures. Limited awareness, lack of understanding about deceased organ donation among the public. So we need to raise awareness as much as possible. Cultural beliefs, training and resources. So lack of trained healthcare professionals and resources for organ retrieval and transplantation, which we need to look into. So the roadmap for establishing a deceased organ donation program will take a few steps. So the step number one is awareness and education. There are quite a few actions, as our previous speaker has already mentioned about how we can collaborate with voluntary organizations and NGOs who work for deceased organ donation. We can raise awareness among the public, and we can dispel the myths and superstitious beliefs that are attached to it. Policy and regulatory framework comes as the second step, where we need to develop state-specific guidelines and policies to streamline organ donation procedures and ensure ethical practices, simplify consent processes and legal requirements to facilitate organ donation, and state government's approval to perform organ donation and transplantation. We can also formulate and implement policies that align with the national regulations, considering Meghalaya's unique culture and context. Hospitals from Meghalaya has to apply for license to conduct organ transplant with the state appropriate authority which already exists, as we have come to know from the initial part of the program. In the form is prescribed in the Transplantation of Human Organs Act, Rules, 2014, form number 12. Step number 3 is infrastructure development, as it has already been highlighted. So we need to invest in infrastructure development, including the construction of transplant centers and procurement of equipment. Step 4 is training and capacity building. Conduct training workshops, seminars, and continuing education programs for medical staff and volunteers. Establish a system for ongoing training and skill development to ensure readiness for organ donation and transplantation. So step 5 is donor registry. We need to have a centralized donor registry to maintain records of recipients, potential donors, and streamline the organ allocation process so that it's a transparent registry everyone can access to, and also develop an online platform for donor registration accessible to the public. Currently, Zule Foundation actually entails all the facilities in our website. People can come to our website and pledge their organs if they want to. As Sir has already highlighted, that there is no legal entitlement to a pledge that is made by an individual to donate organs after death. Hospital integration is the step 6. There are a few actions here as well. So the state government's role here is to adopt the Transplantation of Human Organs Act 1994. We are unclear if Meghalaya has already adopted the act. Formation of advisory committee. It's in it's point number 13, clause 1 and 2. So advisory committee of the central and the state government to aid and advise the appropriate authority, the apex body of a state. So formation of appropriate authority, which is already existing in the state. Formation of SOTO, formation of a brain death committee, principles on organ allocation, state orders making brain death certification mandatory in public and private hospitals. So we have references as government orders that are available from Health and Family Welfare Department from Tamil Nadu and Chennai. So as they are leading as states in terms of deceased organ donation, we can take references of the government orders which have already been passed. So state presentation, so I will not take a long time. To proceed, I would like to introduce Zule Foundation. It was founded in the year 2013 by Srimati Zule and co-founded by Mr. Amitabh Gohain. It is based in Guwahati, Assam, and we were fortunate enough to be awarded as the fourth most influential NGO of India by National Organ and Tissue Transplant Organization, Government of India, in the year 2017 for doing the incessant activities that we have been doing since last 10 years. The organization's vision is to dedicate itself to the advancement and or dissemination of information regarding organ donation and its importance to the society at large, with a vision to meet the shortest crisis of organs in the near future. We are basically focusing on the northeastern region of India at this moment. So to start off, our journey began in 2020 when we started meeting with various officials to make diseased organ donation a reality in the state of Meghalaya. Over the past 3 years, we have visited the state regularly, advocating for this cause. And today, we are really thankful and we extend our heartiest gratitude to Dr. Zule sir and also Health Minister Madam for actually giving us this opportunity. And we are currently conducting this first sensitization program with the help of the state government of Meghalaya. And this milestone is a result of the combined efforts of the government of Meghalaya and Zule Foundation. So we took 3 years to reach here. So I'm just sharing a few glimpses of how we have been to the state, doing awareness programs as well as state government lobbying. It's been a continuous effort since 2020, and here we are today. So to begin with, Sohar sir has already presented the statistics of diseased organ donation. But if we see from 2016 to 20, a 5-year data that we have with us of the road accident fatalities in northeastern states. So we see that there is a total of 18,076 individuals, persons who were killed in road traffic accidents in northeast India. And he has already mentioned that road traffic accidents in India actually leads to the most number of potential cases of brain death. So how many lives could have been saved if we consider 50% of 18,076 individuals that have passed away in the road traffic accidents? We could have saved 18,076 kidneys, lungs and corneas, and 9,000 hearts, livers and pancreas. We have wasted them all, and we could have saved 81,345 lives till date of Northeast India in just last 5 years. But we have cremated or buried all these organs and wasted them all. But on the contrary, in the last 5 years, we have had a lot of people, our brothers and sisters from Northeast India, moving to different states of India to get transplants done. So the current state of organ donation in India, as per a report of Organ India, the number of people waiting for organ transplants in our country, for kidneys, over 20,000 patients are in need of a kidney transplant. For liver, we have 50,000 patients. For heart, it's 10,000 patients who are waiting for a life-saving organ at this moment. Number of deceased donors per year. As per NOTO 2020 and 21 report, India has about 1,000 donors only annually who are contributing to the donor pool. And the rate, as per 21 census, is 0.52 per million population. So you can imagine in which state we are. So comparison with the global statistics, sir has already shown it to us. So Spain is leading in the global.
Unless it reaches your doors, maybe your home or your family members or your neighborhood, nobody is aware about it. Organ transplantation is one such medical issue which many, unfortunately even many of us, the medicos, are also not very much aware about the procedures, the legal procedures, because we have read the technical part of it in the medical textbooks, but after that there are so many legal procedures which we are not aware of. And when the Jubilee Foundation first met me and told me that there has to be an awareness program about organ transplantation, I jumped on that idea and I said, yes, we need to do this program, especially for our senior functionaries in the health department. I was going through the data and I was shocked to see that Meghalaya is one of the states wherein there is no registered or recorded organ transplantation, which means that we do have an appropriate authority. Can you tell me who's the appropriate authority in the health department for organ transplantation?
We have the SOP.
There has to be a committee.
Yes, there's a committee.
How many, such applications must have come to the committee?
For transplantation.
Transplantation.
In a quota, maybe 4, 5.
Very few. Now, because of the legal provisions, that is the Transplantation of Human Organs Act 94, which has been amended from time to time, it's not a cakewalk. You just get a transplantation. There's a lot of procedures in place, and the transplantation can be either from a near relative donor, or it can be out of affection, or it can be out of disease. A very huge potential lies in the deceased organ donor, but unfortunately that is one area which has not been explored, especially in India and particularly in northeastern region. We do not have proper cadaveric storage systems, and for that reason many of the patients who have a brainstem death, they cannot be stored, and since these cannot be stored properly, so such an organ transplantation becomes nearly impossible. It is impossible. And we must know that if there is a cardiac arrest, only few organs can be transplanted, but in case of a brainstem injury, about 36 to 37 organs can be transplanted. So that is a very it's a potential area which remains unexplored because we, the policymakers, are not aware about many of the legal provisions on organ transplantation. As I said before, unless such a thing happens in your neighborhood or in your family, you do not understand the importance of the organ transplantation. And the purpose of this particular program is to create awareness amongst especially the health care officials, and I believe this program will go a long way in making all of us aware. We have Professor Sarveshwar who will be enlightening us